Hello everyone, in the current session let us discuss about CPT coding guidelines for surgery, integumentary system, part 8. In the current session we will be focusing on other procedures, pressure ulcers, burns and their local treatment. Now first coming to other procedures. The first CPT is 15780. That is nothing but derma abrasion, total face. For example, acne scarring, fine wrinkling, rhytids and general keratosis. The next is 15781, which is nothing but derma abrasion segmental. First is 15780 derma abrasion total face. The next is 15781 derma abrasion segmental. The next is 15782 derma abrasion regional other than face. Next is 15783 derma abrasion superficial any site, for example tattoo removing. The next is 15786 abrasion single lesion, for example keratosis or scar. The next is an add-on code plus 15787 for each additional 4 lesions or less. The next is 15788 chemical peel facial epidermal. The next is 15789, which is nothing but chemical peel facial dermal. The next is 15792 chemical peel non-facial epidermal. The next is 15793 chemical peel non-facial dermal. The next is 15819 cervicoplasty. The next is 15820 blepharoplasty lower eyelid. Blepharoplasty is nothing but a type of surgery that removes excessive skin from the eyelids. Blepharo means eyelids. The root word blepharo means eyelids. Next CPT is 15821. Blepharoplasty lower eyelid with extensive herniated fat pad. The next is 15822 blepharoplasty upper eyelid. The next is 15823 blepharoplasty upper eyelid with extensive skin weighing downlid. The next is 15824 Ritidectomy forehead. Ritidectomy is also called as facelift. It is a cosmetic surgery for more youthful and young skin. Ritid means wrinkle of the skin. So ritidectomy, ectomy means removal. So ritidectomy is removal of wrinkles in simple words. So 15824 is ritidectomy forehead. The next is 15825 ritidectomy neck with the platymal tightening. The next is 15826 ritidectomy neck with glabellar flown lines. Now coming to next CPT, that is 15828, that is ritidectomy cheek, chin and neck. The next is 15829 ritidectomy SMAS flap. SMAS is nothing but superficial musculo-aponeurotic system. The next is 15830 excision, excessive skin and subcutaneous tissue including lipectomy. Lipectomy is nothing but fat removal. Abdominal infraumbilical paniculectomy. Paniculectomy is a surgery done to remove stretched out excess fat and overhanging skin from your abdomen. Ectomy means nothing but surgical removal. So paniculus is nothing but a dense layer of fatty tissue growth in the lower abdominal area. So paniculectomy is nothing but surgical removal of paniculus. Paniculus is nothing but a dense layer of fatty tissue. So 15830 is nothing but excision, excessive skin and subcutaneous tissue including lipectomy, abdomen, infraumbilical paniculectomy. The next is 15832 excision, excessive skin and subcutaneous tissue thigh. The next is 15833 excision, excessive skin and subcutaneous tissue leg. The next is 15834 excision, excessive skin and subcutaneous tissue hip. The next is 15835, which is nothing but excision, excessive skin and subcutaneous tissue buttocks. The next is 15837, which indicates the anatomical region forearm and or hand. The next is 15838, which indicates submental fat pad. The next is 15839, other area. The next CPT is 15840, graft for facial nerve paralysis free facial graft, including obtaining fascia. The next is 15841, graft for facial nerve paralysis, free muscle graft, including obtaining graft. The next is 15842. 15842 is nothing but graft for facial nerve paralysis, free muscle flap by microsurgical technique. The next is 15845, which is nothing but graft for facial nerve paralysis, regional muscle transfer. The next is an add-on code plus 15847. Excision, excessive skin and subcutaneous tissue, including lipectomy, abdominoplasty, including umbilical transposition and facial pellication. List separately in addition to code for primary procedure. We must use 15847 in conjunction with 15830. Now coming to abdominoplasty. Oplasty is nothing but surgical repair. The suffix oplasty is nothing but surgical repair. Abdominoplasty is cosmetic surgery to improve the shape and appearance of the abdomen. Now coming to the next procedure, 15850. Removal of sutures under anesthesia other than local, same surgeon. The next is 15851. Removal of sutures under anesthesia other than local, other surgeon. Next is 15852, dressing change for other than burns under anesthesia other than local. The next is 15860, intravenous injection of agent, for example fluorosin, to test vascular flow in flap or graft. The next is 15876, suction assisted lipectomy, head and neck. Lipectomy is nothing but any surgical procedure carried out to removal of unwanted body fat, usually by suction. So 15876 is suction assisted lipectomy, head and neck. The next is 15877, suction assisted lipectomy, trunk. The next is 15878, suction assisted lipectomy, upper extremity. The next is 15879, suction assisted lipectomy, lower extremity. Now let us discuss an example. The patient is coming for removal of fatty tissue of the posterior iliac crest, abdomen and medial lateral thighs. Suction assisted lipectomy was undertaken in the left posterior iliac crest area and was continued on the right and lateral trochanteric and posterior aspect of medial thighs. The medial right and left thighs were suctioned, followed by the abdomen. The total amount infused was 2300 cc and total amount removed was 2400 cc. The incisions were closed and a compression garment was applied. What CPTs are to be reported? Here, fatty tissue removal, lipectomy is done with suction of abdomen and thighs. In thighs, it is a bilateral procedure because right and left thighs were suctioned, followed by abdomen. So the first CPT is 15877, which is nothing but suction assisted lipectomy, trunk, to indicate abdomen. The next is 15879, which is given by 50 modifier and 51 modifier. 50 modifier indicates it is a bilateral procedure because both right and left thighs were suctioned. Then 51 modifier indicates multiple procedures are performed during the same session. So 15879 along with 50 and 51 modifier, which is nothing but suction assisted lipectomy, lower extremity. These are the appropriate codes for this particular example. Now coming to the next topic, pressure ulcers. What are pressure ulcers? Pressure ulcers are also called as pressure sores or bed sores. They are the injuries to the skin and underlying tissue primarily caused by prolonged pressure on the skin. Pressure ulcers are usually seen in bedridden patients. Now coming to the CPTs of pressure ulcers, the first CPT is 15920, which is nothing but excision of coaxial pressure ulcer, coxectomy with primary suture. And the next is 15922, excision coaxial pressure ulcer, coxectomy with flap closure. The next is 15931, excision sacral ulcer with skin flap closure. The next is 15935, excision sacral pressure ulcer with skin flap closure with osteectomy. Osteectomy is nothing but surgical removal of all or part of a bone. The next is 15936, excision sacral pressure ulcer in preparation for muscle or myocutaneous flap or skin graft closure. The next is 15937, excision sacral pressure ulcer in preparation for muscle or myocutaneous flap or skin graft closure with osteectomy. The next is 15940, excision ischial pressure ulcer with primary suture. The next is 15941, excision ischial pressure ulcer with osteectomy or ischectomy. Ischectomy is surgical removal of segment of hip bone including ischium. The next is 15944, excision ischial pressure ulcer with skin flap closure. 15945 indicates excision ischial pressure ulcer with skin flap closure with osteectomy. The next is 15946, excision ischial pressure ulcer with osteectomy in preparation for muscle or myocutaneous flap or skin graft closure. The next is 15950, excision trochanteric pressure ulcer with primary suture. Next is 15951, excision trochanteric pressure ulcer with osteectomy. The next is 15952, excision trochanteric pressure ulcer with skin flap closure. The next is 15953, excision trochanteric pressure ulcer with skin flap closure with osteectomy. The next is 15956, excision trochanteric pressure ulcer in preparation of muscle or myocutaneous flap or skin graft. 15958 indicates with osteectomy. Next is the final CPT 15999, unlisted procedure, excision pressure ulcer. Now let us discuss an example. A surgeon excises a ischial pressure ulcer with osteectomy. Several days later, she closes the operation wound by muzzle flap. What CPT codes are to be reported? The first is 15946, excision ischial pressure ulcer with osteectomy in preparation for muscle or myocutaneous flap or skin graft closure. Next is 15734, along with 58 modifier to indicate that it is a planned procedure. Muscle, myocutaneous or fasciocutaneous flap trunk. Now coming to the next topic, burns and local treatment. So first of all, what are burns? Burn is a tissue damage with partial or complete destruction of skin caused by heat, chemicals, electricity, sunlight or nuclear radiation. The burn codes apply to thermal burns except sunburns that come from heat source such as fire, hot appliances, electricity and radiation. Corrosions are burns due to chemicals. Now coming to the classifications of burns based on their degree. Burns can be categorized into first degree, second degree and third degree burns. The first degree burn indicates damage to the outer layer, epidermis of the skin along with erythema. Second degree burn indicates blistering with damage extending beyond the epidermis partially into the layer beneath it, that is dermis. Next, third degree burn indicates full thickness tissue loss with damage or complete destruction of both layers of skin, including hair follicles, oil glands and sweat glands. Now, in order to calculate the total body surface area of the burn, each and every anatomical region of human body has been allotted certain percentage of surface area, and it is different for adult and for infants. For example, the surface area of head for infants from birth to 1 year is 9%, whereas the surface area of head for infants from 1 to 4 years is 17%. And for the surface area of head is 7% in an adult. So the percentages vary and they must be calculated by this table. And only second and third degree burns are included in the total body surface area burnt percent. First degree burns are not included, only second and third degree burns are included in the calculation of TBSA percent. Total body surface area burnt percent. Coming to the guidelines, the procedures come under the code range 16,000 to 16036 refer to local treatment of burnt surface area only. And the codes 16020 to 16030 indicate or include the application of materials, for example dressings, that are not described in the codes 15100 to 15278. Documentation of body surface area involved and the depth of the burn are necessary for code selection. This is also an important point. The documentation of body surface area involved and depth of the burn are necessary for code selection. And for other related medical services like hospital visits, detention, refer the appropriate E&M and medicine sections. That is, those codes are allowed. For application of skin grafts or skin substitutes, we need to refer 15100 to 15777 series. Now let us discuss the various CPTs of burns. The first CPT is 1000, which is nothing but initial treatment, first degree burn when no more than local treatment is required. Initial treatment of first degree burn, you need to report 16,000, which is nothing but 16000. The next is 16020. Dressing and or debridement of partial thickness burns. Initial or subsequent, small. That is, the surface area is less than 5% of the total surface area. The next is 16025. Here dressing and or debridement of partial thickness burns, medium. That is, surface area ranges from 5 to 10% of the total body surface area, for example whole face or whole extremity. The next code is 16030. Dressing and or debridement of partial thickness burns, initial or subsequent, large. Here the surface area is greater than 10% of the total body surface area, for example more than one extremity, etc. The next is 16035. Hysterectomy, initial incision. Hysterectomy is an emergency surgical procedure involving incision through areas of burnt skin to release the eschar. Eschar is nothing but collection of dry and dead tissue within a wound. Next is plus 16036, which is an add-on code for each additional incision. Otomy is opening or incision. Now let us discuss an example. A 25-year patient presents with second degree burn of neck and burn tissue was debrided and dressing was done. What CPT code is reported? The appropriate answer is 16020, which is nothing but dressing and debridement of partial thickness burns, initial or subsequent, small, which is nothing but less than 5% of the total body surface area. If you see the table, neck of an adult male indicates 2% of the total body surface area. Hence it is indicating 2%. The appropriate code is 16020, where the surface area is less than 5% of the total body surface area. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.